This video is on rheumatoid arthritis. Rheumatoid arthritis is an inflammation of the synovial fluid. It causes joint inflammation, bone mass destruction, and it also causes osteoporosis-related fractures due to it. So for rheumatoid arthritis, unfortunately, there is no laboratory test to detect positive confirmation that a patient has rheumatoid arthritis. However, there are several things that one can look for to give a reasonable determination that this patient does have it. One of those is the immunoglobulin M rheumatoid factor. Most patients have this, and it is a big indicator that they have rheumatoid arthritis. Another indication would be to run a mineral bone density test. You're looking specifically at the T level to determine if this patient has rheumatoid arthritis. There's also that high risk of fractures that I keep bringing up. Your patient will have fractures, fracture very easily. That's another strong indication that they have rheumatoid arthritis. All of these combined usually lead physicians to determine that they are positive for this illness. And usually your patients will be able to tell you if there's any stiffness or pain. It's really also going by the subjective data that is given by the patient. So clinical manifestations of rheumatoid arthritis is stiffness in one or more joints, and this usually occurs in the morning and it lasts for several hours. This stiffness will occur in the hands and the wrists or the feet. Many patients claim that they feel as if they are walking on pebbles, so it's very painful. They can also have debilitating fatigue, tiredness and not wanting to do anything, malaise. And then there's the depression. The depression stems from them having a distorted body image because their hands, their wrists, or their feet begin to become deformed. They also lose much of their mobility, and they have a disease that hurts and it's painful. So for this patient, you're going to want an interdisciplinary team. It, of course, will include your rheumatologist. It will include a social worker to assist with perhaps activities at home, a physiotherapist, a pharmacy to ensure that the patient is being prescribed the correct drugs, and a clinical manager to see this patient through the whole process and continue at home. Treatment, you just want to consider that you reduce the joint pain and inflammation for your patient, maximize that joint function, and then you also want to prevent joint destruction and deformity. Again, the deformity is actually the first thing people think of when they consider rheumatoid arthritis as a diagnosis. So, the medications that are considered in a treatment plan for rheumatoid arthritis include nonsteroidal anti inflammatory drugs known as NSAIDs. These include things as ibuprofen, Tylenol, or naproxen sodium. You also want to consider corticosteroids. Opioid analgesics is also a consideration for the pain. And then specific drugs such as methotrexate, hydroxychloroquine, which is a drug that was made popular during COVID. Many people were turning to that. And then sulfasalazine. These drugs can assist a patient getting through a flare up and perhaps keeping any flare ups at bay. And they're usually given on a time schedule so the patient's pain is reduced. So, a nursing diagnosis for rheumatoid arthritis would be impaired physical mobility, related to pain and discomfort, as evidenced by limited range of motion. Um, these are clear signs of rheumatoid arthritis. So, your outcomes may be the client will maintain a position of function with an abscess of contractures, meaning they are able to continue a quality of life. And then you also would have client will maintain or increase the strength and function of the affected body part so that again they can continue on with the quality of life. Interventions would include assessing and continuously monitoring the degree of joint inflammation of your patient as well as the pain. And then you want to see what the level of activity and exercise is according to how bad the inflammation is for your patient. You also want to assist with active and passive range of motion and provide resistive exercises and isometrics for the patient to do whenever they're able. And this is because it maintains and it improves that joint function and the muscle strength, and it keeps the stamina of the patient. So, an evaluation for this nursing plan would be that your patient retains the ability to perform ADLs, activities of daily living, and you also want the patient to maintain a medication regimen, not to skip medications, which would help reduce pain and perhaps help reduce flare ups. Patient teachings, I would teach the patient to create a medication schedule to reduce pain, teach about the signs and symptoms such as morning stiffness, fatigue, and weakness, which are common in rheumatoid arthritis, and to teach the patient active or passive range of motion exercises.